Make certain that it continues.
Monday night at 9 on MPT. Programs on MPT are made possible by our members and the following.
When looking for the perfect tree this holiday season, visit one of Carroll County's many tree farms. So whether you're looking for a live tree, a pre-cut tree, or want the excitement of cutting down your own, come to Carroll County, Maryland, and find your perfect tree to celebrate the holidays.
University of Maryland Center for Environmental Science, leading the way on Chesapeake Bay restoration, while guiding our state, nation, and world toward a more sustainable future.
Are you a Maryland renter at risk of being evicted due to COVID-19 related issues? Help is on the way with Maryland's Emergency Rental Assistance Program. You may be eligible for assistance in helping to pay current or past due rent and avoid the threat of eviction because of wage loss or illness due to the pandemic. To learn more, visit rentrelief.maryland.gov or call 877-546-5595.
State Circle is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you.
Connecting Marylanders to their government. This is State Circle.
Good evening and welcome to State Circle. Tonight, a trailblazing legislator is calling it a career and new ideas to overcome pandemic learning loss. Those stories ahead. First tonight, one big employer struggling to find out which of its workers are vaccinated. The employer is the Baltimore County government. We spoke with County Executive Johnny Olszewski. Mr. Olszewski, thank you very much for joining us. Your county has about 9,000 employees, and you've wanted them to report their vaccination status as of this week. Where does that stand?
First, I want to just thank our employees for recognizing that we have an obligation to the public we serve and to each other. And we are currently at a place where 2/3 of our workforce have reported that they are vaccinated. We are still waiting to hear back from another third before we start implementing the testing requirement as part of this initiative.
You were asking everybody to fill out the report, though. So frustrated at all that the data, the forms or whatever are late coming in?
Well, we know that vaccines are safe and they're effective, which is why we've encouraged not just our public, but also our employees to get vaccinated. We've made every effort to give folks time off to make them accessible. And so, yes, we want to have all of our employees vaccinated. It's very possible that more than 2/3 actually are vaccinated. It's just that we know that 2/3 have gone through the process to upload that information so that we can not have to go through the testing protocols with them. So we hope that as that starts and as that ramps up and as we continue to support them, we find that more of our employees are in fact vaccinated.
What are your plans for testing? You're not the only employer that's set up this way, that we want you to be vaccinated. If you're not, we want testing. This is going to be weekly?
Yes, so this will be weekly for any employee who either isn't vaccinated or does not upload their vaccination status to Baltimore County. We've engaged with a vendor who will be on site at many of our police and fire, actually all of our police and fire precincts and firehouses will be at major county installations like our Drum Castle Public Health Center, our county courthouse. Really, we've used the data to drive making this as easy and fair as possible for our employees, because we've done this in partnership with our union organizers and representatives to make sure that this is a policy that's fair, but also acknowledges our shared commitment and need to uphold public health.
What concerns did you hear from the union representatives? And maybe what are you hearing from the people who've been resistant either to getting the vaccine or to uploading their vaccination card?
Yeah, so it was everything from privacy concerns, and we've actually implemented a workaround that's a paper workaround so that people can literally show their physical card to us to show their vaccination status, to how difficult it would be to get testing. And we've worked through all those issues in partnership with those who represent our employees to make sure that as concerns have been raised, that we've addressed them. We think this is a very fair policy. It's straightforward that says, we think, again, the best way is to get vaccinated so that you don't have to be subjected to the weekly testing. But if you choose not to, and if you choose to, for whatever reason, not get your vaccination, we're going to require that testing. But again, it's been done in partnership with those who represent our employees. We think it's important that we recognize the need to get vaccinated, but at the same time to work with our employees as we stand up these policies.
The number I saw for the response from the police department, which I think includes sworn and civilian employees, was significantly lower. It's like 44% is what I saw. Are there any special issues there?
Yeah, I mean, we see that our public safety areas, fire is at 56%, police is at 46% in terms of acknowledging and known vaccination status. For whatever reason, as we see across the country, there's some hesitancy to either report it or actually get vaccinated. We're working with Chief Hyatt and Chief Run to literally go station by station to try to talk to our officers and firefighters, correctional officers about the importance of this vaccination to keep them safe, to keep the public they serve safe. But again, working with union reps to, in the case of individuals choosing not to either submit their status or get vaccinated, providing a mechanism to make sure that we're testing and keeping our workplace and our public as safe as we possibly can.
I guess that, it's a little concerning because that's like NFL quarterback compliance numbers, and you wonder if these are frontline workers, first responders who are in constant contact with the public. Maybe they figure they've already been exposed 10 times and they don't need it.
And some people have said that, Jeff. This is about us, though, trying to do what's best for our employees and for the public. It's my hope that as we begin the testing protocols as part of this policy, we actually see those numbers continue to rise. We know that there's a significant number of our outstanding employees who are in those two agencies specifically. I believe it's about 2/3 of our outstanding employees are in public safety. So we are taking a special time and attention to make sure that we're working with our leadership in police and fire, both union and our leadership teams, to try to share the message of why this is important for them, for our communities. And again, if folks choose not to get vaccinated there or across county government, we expect that testing hopefully will either increase the testing, increase the vaccination rates, or just be a step to keep our employees and our public safe.
We've been fortunate throughout the pandemic to be able to talk to your county health officer, Dr. Branch, a number of times. Last time we talked to him, it was pretty clear that the vaccines don't 100% stop people from being able to transmit the virus. You can be typhoid Mary even though you're vaccinated, but they're incredibly effective at keeping people out of the hospital and out of the morgue, which seems like it would be a really strong selling point.
Well, and that's what we're telling the public. Dr. Branch and his team in the health department have done an outstanding job. We've been recognized in Baltimore County as the gold standard in the state and a national model for vaccination efforts, first at the Timonium Fairgrounds and now at White Marsh Mall and other locations for our youth vaccinations. But yeah, we know these are safe. We know they're effective. 70% of cases are still among those who are unvaccinated. And then even for the small amount of breakthrough cases that we're seeing, people are not going to the hospital and not dying at the same rate of people who are unvaccinated. So the message is strong. Get your booster if you haven't gotten it yet. Get your vaccine if you haven't started the regimen. And for parents of young children, I encourage you to look at the science. And like our family, we've chosen to get my daughter vaccinated to keep her and our family safe.
What's the county's role when it comes to that new younger group, 5 to 11, for whom the vaccines are now approved?
So we're taking a three-pronged approach to this effort to vaccinate our youngest individuals, now available 5 to 11. We're setting up larger scale clinics at places, like I mentioned, at White Marsh Mall and other locations across the county. We're partnering with pediatricians across Baltimore County, and we're also working with the school system to provide direct clinics at our school sites so that parents have a variety of options to make sure that their needs are met, that they can protect their children. And hopefully that helps us get back to some sense of normalcy as we come out through this winter, that we have adults who are vaccinated, who are boosted, and children who have that access as well. So coupled with better treatments and better testing access, it's my hope that as we make this final push, we are approaching some return to normal.
Where do you stand with the state of emergency that kicked in at the beginning of the pandemic?
Yeah, so we have let the state of emergency expire in Baltimore County. We've consistently said that we will only employ it as it's absolutely necessary. And it's been useful for us. It's been able to expedite contracts with employees, to stand up our site at the White Marsh Mall in terms of the clinic and contracts. But we're at a place now where we feel like we have the pandemic manageable from a public management perspective. We have the resources we need, the people we need. We certainly will act if things unfortunately go in the wrong direction. But at this point, we feel like we have a plan in place and that does not require a continuation of the state of emergency. But we'll continue to do whatever it takes to keep our folks safe.
Let's talk a little politics before we go. You have proposed public financing of political campaigns. It would not start with this coming election.
Yeah, so we were excited that one of the first pieces of legislation we introduced to put on the ballot in Baltimore County was public financing of elections. It allows for a more diverse group of candidates, more diverse pool of candidates. Governor Hogan was elected through public financing. So we were excited that voters overwhelmingly supported that in the last election. And so we have before the council enabling legislation that will finally stand up this public financing, this fair election fund. And we trust that it will empower our residents because, big money shouldn't be what drives our policy, and your voice shouldn't be determined by the size of your wallet. So we're excited to have the council consider this and hopefully pass this in the weeks ahead.
Johnny Olszewski is the Baltimore County Executive. Sir, thank you for your time.
Always a pleasure, Jeff. Thanks again.
Longtime Baltimore delegate Maggie Mcintosh announcing this week that she will not seek re-election. The leader of the powerful Appropriations Committee spoke with MPT's Nancy Yamada.
Delegate Mcintosh, since your big retirement announcement, I've seen so many tweets and posts on social media from constituents and lawmakers, which must be so gratifying. House Speaker Adrian Jones, she called you an exceptional leader and said that your 3-decade career has been nothing short of groundbreaking. But how did you decide it was time to retire?
Yeah, that's a very good question, and one I've been asked multiple times, obviously. I will tell you that I began to think about retirement probably as early as 5 years ago. The reason being, when you're in a job for 30 years and the job is as demanding as this is, you just begin to think about what else could I do or should I do anything else? And by the way, I am 73, going to be 74 soon. And I just thought it was time for me to move out of the way of what I see behind me as incredible, exceptional young leaders who could step into a number of roles in the legislature.
In your announcement, you talked about some of the pieces of legislation that you have helped pass over the last 30 years that you are most proud of. You talked about the DREAM Act, the Chesapeake Bay Restoration Fund. What other laws come to mind?
I have to tell you that the two areas that stand out for me and always will is the work that I was able to do, not just as appropriations chair, but even as a freshman delegate under Howard Pete Rawlings when we passed the Thornton Act. Then as chair, I was here to be a part of the Kerwin Commission to pass the blueprint for Maryland's future. I also basically pulled together a group that authored the Built to Learn, which is the capital funding for schools, which will help so many schools all across the state get built or remodeled, renovated, so our kids in Maryland have safe and clean and healthy spaces to learn in. So that's one area, education. But the other one is the passage of same-sex marriage in Maryland. Was personal to me and many of my colleagues. And of course, I did not do this by myself at all. That's not even, I was just there and helped and worked with so many groups that believed that this was a civil right that my community needed.
You have held so many leadership positions. How have you seen the status and role of women change in politics over the last 30 years?
It's changed quite a bit in the House of Delegates and the Senate. And that is, I think, in large part because of Speaker Michael Aaron Bush. For instance, the first meeting I attended as House Majority Leader, I walked into the room and there was only one other woman there. And there was only one person of color there. And yet this week, when I go to a House leadership meeting with Speaker Adrian Jones, I'm going to walk into a room that has many people of color and many women sitting in the room. It has changed tremendously over the last 20 years, and its change will make us stronger and a better legislature.
You represent Baltimore City. The latest census shows that Baltimore's population is at its lowest in a century. How do you think that trend can be reversed?
Right. I think all urban areas have tremendous problems right now. 1, with crime, 2, with aging infrastructure, 3, with schools that have been underfunded for years. And I think the blueprint for Maryland's future that we passed, plus Built to Learn, will help Baltimore City, especially those kids who need us the most, be lifted to a new achievement in their educational career. The other is crime. I mean, I think we have to address crime in a very different way. Crime and these shootings are not happening between people who have conflict necessarily. There are a lot of really broken young people in our community who've come up through now generations of really severe poverty and live in broken neighborhoods. And the trauma that they have seen and faced is what we need to address.
And finally, the question everyone wants to know is, what's next for Maggie Mcintosh?
A little bit more time to relax, but in all honesty, my wife and I plan to do what we love to do, which is travel quite a bit and spend more time with family, more time with friends, and just have, I hope, some kind of meaningful contribution that I can continue to make for the city and for the state.
Delegate Mcintosh, thank you for your time, and we wish you all the best in the next chapter.
Yeah, thank you.
Our newsmaker this week is Kevin Lowndes, Deputy Superintendent of the Charles County Public Schools. Sir, thank you for joining us. You've come out with a new plan to help students recover from pandemic learning loss, and we'll get into the details. But to start with, how do you assess the problem?
So what we did was we ended up going with iReady, which is an assessment that we are able to determine where our students are, both within reading and within our math. And it looks at their, the core skills that they need in both those areas. And it determines where they are missing some of those functional skills. And so in giving all of our students this test, we're able to determine, where they are and where they should be. And it also lets us know where they are compared to all other students, both within Maryland and nationally. So we have a good indication of where our students are and what we need to do to help them get caught up.
If you gave that test to 100 kids, how many would you say are close to where they ought to be? How many are a little bit behind, and how many are, really far behind and have really been hurt by the pandemic?
So unfortunately, we're looking at only, less than 10% that it really are where they should be at this time. And we're looking at, a large number of students that need substantial help and support and extra time working on their functional skills to get them where they need to be.
That's a crisis. And you hear very little public discussion about this. Maybe there's a lot more within your profession.
There is definitely a lot of discussion within the profession because, when we looked at where the folks are nationally to compare our students with, what we've noticed is that nationally, everyone's having the same problem. At this time that we've been away in distance learning, our students just weren't able to get the same amount of material and learn it at the same rate as they were when our students are back into schools. And so we're very thankful that we're back in our brick and mortar locations. But, we have to spend now time helping our students not only move ahead from where they should be in their grade level, but find other times to help get caught up in the areas that they missed while they were home learning in a distance learning format.
And even this new school year, which we're a few months into, isn't perfect in terms of the learning environment. You still have people wearing masks, I think. a few cases of quarantines. Do you think what's happening now is comparable to a normal school year in terms of the amount of instruction you're able to do on a regular day?
So it's been a very challenging year for many of our staff members in our buildings because, with COVID, we have staff that are both, coming in and then going out and being quarantined. We have students coming in and then having to go out and being quarantined. And then during this time period, it's been extremely difficult to hire and get enough people to both teach our students, but also support the teaching that goes on within the building. So, we're talking our building service folks, we're talking our cafeteria folks. And so it's been a challenging year because we have our people, our teachers, our administrators, and everyone else in the building that supports our students doing multiple jobs because we just haven't been able to hire the amount of folks that we usually do when we were in pre-COVID. So it's been a challenge to try to make sure that our students are getting what they need every day, but just that we have the folks there in the buildings to help our students learn on a regular basis every day.
All right, one last question before we get into the details of the plan. Just to point out that you weren't born into the administrator's office there. You've been a special education teacher, general education teacher in some big school systems, Montgomery County, Maryland, the giant LA Unified District in Los Angeles. So you've got a variety of perspectives on this.
Correct. And, the one thing I've learned is that, students are students and that we need to take care of them and that it's really important to have those relationships with the students and to help them learn. And so that's why it's so important to be back in our schools so that our teachers can really interact with our students to help motivate them and help them get the support that they need. It's really difficult when we are in the distance learning to be able to identify where our students were struggling and have the time to really pinpoint interventions that would help them get to where they need to be. So, I'm thrilled that we're back in our buildings and our teachers are able to work with our students directly.
Now, this is a 3-year plan for Charles County. Where do you start? How does it progress over the 3 years?
So, it's a continuous plan that's going to be year round. And it really started last summer when we were able to bring our students back into the schools. We offered multiple summer programs focused in on areas that our students needed help and support with math and with reading. We looked at our students that are at the high school level and credits that were lost while they were at home in the distance learning format. We offered multiple opportunities for our students to get caught up at the high school level. We also looked at our students that have special education and have IEPs, individualized education plans, and where they were falling short on their goals and offered summer programs to identify those areas and support in those areas. So the summer really kicked us off. And coming back into the school year, we used the data that we collected this summer to identify extra supports that our students needed. And we used that iReady data to identify areas and gaps that our students needed. And so we adjusted our school day to make sure that we had time during the school day to address some of these needs. So we have a large reading block in the elementary and the middle school level where we have a portion of that block. Teachers are focused in on accelerating our students, which means they're really working in on focus on the current grade level curriculum. And they're making sure that our students are getting that, with the understanding that there are areas that they missed while they were at home in the distance learning. And so a portion of that block actually is focused in on filling in the gaps. And so our students are then broken up into small groups and we work on the individualized areas that they need help and support. And so that's one of the areas that we looked at addressing was how do we change our reading and our math blocks that will allow us both to move students ahead with their grade level curriculums, but also allow teachers to put time to focus in on the areas that they need help and support.
You're asking a lot of the teachers too.
We are asking a lot of our teachers, and and the one thing that I'm extremely proud of in Charles County is how our teachers have stepped up and our administrators to really help and support our students and our families during this time period. Because the other thing is when you're behind, we don't have a different day than we had prior to COVID. And so we really do need more time. So one of the other things that we're asking our schools to do is to come up with a plan to extend the learning day and extend the time that students will be able to interact with the instructional material. And so they're going to be working with students after school and in other periods of time where traditionally they might have been focused in on something else.
I saw in the plan something about a 90-minute math block, which sort of gave me an instant headache. I wonder, is there a limit to how intense anything can be in a normal school day before kids and teachers hit a wall?
Well, so part of that block is really focused in on supporting students in small groups. And so it's not giving students the new material that they need to move forward with their grade level curriculum. It's really looking at where does this student need extra help and support. And so, for example, in first or second grade, you might have a student that doesn't have much, needs help and support within number sense and is not quite understanding what the number 2 or 3 means. And so you would spend time working with manipulatives with those students at that early grade to help them understand the concept of what the number is. And so it's focused more on the individual.
How can parents and other family members help?
Well, you know, one of the things that we're doing is that we've noticed that our teachers are doing so much extra that we're going to have to go outside and use some companies to help and support us with some tutoring outside of the classroom. So we are working with some companies to provide one-on-one tutoring in the distance learning format so when students are home. So one thing that families can do to help and support is help with setting some time when the students are home to work on some of these skills with the tutor, with these companies that we're buying, and also just spend some time reading with their child at the early grade levels and at the older, when the students are in high school, checking in to make sure that they're doing their homework and they're staying on track. Because I think it's, you know, one of the things that we've noticed, it's been a real adjustment for our students to come back into buildings and to be in school for the full day. Some of them didn't have the structured day that a regular school day presents. And so we're working with them on putting those structures back into place. And I think we could really use some help and support from our families to reinforce that.
Our thanks to Kevin Lowndes, Deputy Superintendent of the Charles County Public Schools. That is our program for this week. We're back Monday with Direct Connection. Does the idea of a big Thanksgiving meal give you indigestion? For expert pre-holiday help, join us Monday evening live at 7. Please follow us on Twitter and Facebook at MPT News. And now for all of us at MPT, thank you for watching and have a good night.
This program was made by MPT to serve all of our diverse communities.
Walk in the footsteps of Harriet Tubman through a powerful and inspiring road trip on Maryland's Eastern Shore. This scenic byway includes more than 30 sites related to Tubman's life. Download the free audio guide with new virtual reality features.
Remember the beauty of being together? Remember the